नहीं कि ये सब उर्दू पंजाबी में है?
English, inshallah.
Okay, thank you.
English is good.
Assalamu alaikum, everyone.
Okay, salam.
Welcome. We are joined by many lovely guests today. We have Dr. Amir and Dr. Zafar Saab with us. And inshallah, we're going to be speaking about COVID-19. And as England plans to move into the different phases, here in Scotland, we've been slightly more cautious in our approach. So inshallah, we will be discussing that. But before we start, I would just like to welcome our panel. So Dr. Amir and Dr. Zafar and Professor Masoom Saab, who's going to host with me. Assalamu alaikum, everyone. Welcome.
Wa alaikum assalam.
Dr. Amir Barney, he's a president of APPNE and a community worker. He's a senior university teacher, academic lead for clinical skills, and co-director for studies. And he also works for numerous charities and supports a local mosque. Dr. Zafar Iqbal Saab is an associate medical director, public health of a large community NHS trust. He has had many years of experience. He is a visiting professor at Staffordshire University. He chairs many different forums. And he was brought up in Halifax, and he's been a very good friend of Dr. Musharraf Saab. So Jazakallah. So obviously two very, mashallah, capable and people with stellar backgrounds and strong experience within the whole public health sector and the community. So Dr. Amir, we'll start with you. Just some general kind of your thoughts and observations about COVID-19. How has it been for you as someone obviously of that kind of professional background? How have you taken it all, and how's it affected your personal life?
Well, my professional background is in medical education now, so I'm a
Mashallah.
full-time academic. But like any other common person out there, it's affected us as well, both individually and in terms of family life, and also collectively as a community. And this, not just the South Asian community, but also the wider community we live in within our own cities. I live in Nottingham. So the impact has been manifold. And again, I go back to when it all started, and when we were first informed by the government and Public Health England as well as to how to work our way through this crisis, this pandemic, which has been a terrible crisis for many, and we have lost many loved ones and families and friends and colleagues across the world, not just in the UK and Europe, but also across the world and elsewhere. So first and foremost, I will always say that my thoughts and prayers go out with the ones who have lost their loved ones, and also to make sure that the ones who are not well, may Allah bless them,
Amen.
And make them better, and also to give the highest regard, or give them the highest honor possible in the afterlife. Amen. So your question to me as a common person, because I'm talking literally like a common person, it was shocking to see how it's been affecting us. It was very difficult, I must admit, for someone who goes to work every day. I leave at 6:30, go to work, come back at 6 or 7 o'clock, take the train as well from Nottingham to my workplace. And it was very difficult in the beginning to be locked inside the house. And to adapt to this new way of working. And we all said we are working from home, but really we were in a crisis and trying to work from home. So it was quite a different way of actually, it's very easy to say working from home, but no, we were being affected by many elements, like the social side of it, the psychological side of it. People were worried, anxious. My family, my two boys came back from university, and they were also locked down alongside with me and my daughter, who is a pharmacist, trainee pharmacist. My wife is still continuing to work. She was working in the hospital, so she was going. So I think we all had to cope, and we all coped individually, but I think we did very well as a community as well, to listen to what the guidelines were from the government. And the guidelines will change, obviously. As you know, today the guidelines have changed after nearly 10 weeks of quite a severe lockdown. So for me, one was to adapt to this new way of working from home. One was to staying safe to begin with, to stay inside the lockdown, follow the guidelines as they were given to us, ensuring that I do not endanger myself and my family as well, and also my neighbors or friends. So I really followed the rules. However, that they were tough or felt to be tough, we had to follow them. And then, we had the blessed month of Ramadan. And And I must say that the Ramadan I found easier this time because I wasn't traveling. So I got a lot of time to, to do my salah, to reflect, to work at my own pace, and then we were with family. Boys were back, for example. So we were all doing our iftars and sahurs together. So there was some good in it as well, although very small good. But we actually were able to sit as a family after many years and look after each other.
Okay, alhamdulillah. So I mean, what I sense is that there was clearly a lot of change, but at the same time, you've had a lot of time with the family, and you kind of, the pace of life has slowed down. You've been able to reflect and enjoy, and some of the reports that were coming out actually from the big tech companies and the big multinational companies was that some of their kind of employees were actually performing better at home and working better from home than the actual offices because they were much more calm and cooler. So, and myself, I'm based at a university. I drive from Glasgow to Edinburgh, and obviously that's kind of stopped for me as well. Dr. Zafar, coming to you, do you think the UK had a very mature response to COVID-19? I mean, if you look at the scale of deaths, US and the UK have been hit hardest. I recently spoke to some of my students in Jordan and Turkey, and their countries have taken a tougher stance. I mean, in Jordan, there's a curfew there. And he was almost shocked when he was speaking to me. He said, UK is known as a leader when it comes to innovation, technology, health service. What's happened with you guys, So I want you to just kind of come on to that.
Yeah, it's a really interesting question. I mean, I suppose in some respects, we won't know until 3-4 years down the road. Then we can all look back and see how well we all performed. I think it's really interesting to see how different countries have approached this. My personal opinion is that I think the government should have acted a lot earlier than it did. I think the government should have acted earlier. I don't think the government was taking. I don't think the Prime Minister was taking it seriously right at the outset. He wasn't attending meetings, and there was that delay in the scientists were telling the government one thing, and the government didn't really click into action. Secondly, I think we could have done much better with the testing. And I agree with you. We're an advanced society, a wealthy society, and we should have organised the sort of testing. The WHO were telling us right at the outset the answer to this testing, and we stopped testing, and now we're starting it again. So I think there's a kind of number of things which are really important. The other kind of aspect to this is the economic consequences. I think the economic consequences could be absolutely devastating, with so many people losing jobs, and what's going to happen to them? With the country, how's the country going to kind of survive? And what about say a firm like Primark goes down? They employ thousands of people in Bangladesh. What's going to happen to those people? So there's all kinds of economic consequences. If we enter a recession, it's going to hit the poorest the hardest, and so the social dimension is quite interesting.
So the economics just is the impact is not just in UK, but it's in all these other countries where UK kind of brings in a lot of the product actually from. So it's kind of far reaching.
Yeah, I mean, there are people arguing that the sort of the people dying because of economic consequences might exceed those people dying of virus.
All right. Wow. Yeah, that's very interesting. Dr. Amir, coming back to yourself, so the UK as a whole is very divided in terms of, firstly, the way that they responded to COVID-19, and number two, in terms of when we're coming out of COVID-19. So I'm based here in Scotland, and Nicola Sturgeon had a slightly different vision of to the response actually to COVID than Boris Johnson. Glasgow is one of the most toughest place in terms of life deprivation, poverty, and it's got one of the worst health. Community was one of the worst health kind of background in the whole of Europe. So Nicola was kind of very aware of that. So firstly, do you think it makes sense for the four nations to have a different outcome? And I mean, there's confusing messages between Scotland and England, what you can do. So what do you make of all that?
Well, again, as a member of the public, I am guided by my government. So my government would be the English government in England, and they are guided by the scientists who will guide the government, and they take so many variables into consideration before they come out with the guidelines. So I couldn't really comment on other countries like Northern Ireland, Scotland, or Wales, for example, because they have their own scientists, their own policies, demographics, and so on and so forth. So for me, I had to follow whatever guidelines I was given by the English government, as they were informed by.
Can you perhaps just maybe touch on the fact that why is it that different scientists have a different outlook actually to this? I mean, what are the factors that they're basing their decisions on, and their this kind of outlook?
Well, this really would be something for Dr. Zafar to comment on, coming from Public Health England. I would obviously, as I said, I'm very much guided by what I've been informed by my government, by the English government, and also by the local trust or by the local doctors, the GPs, for example, or NHS 111. The thing is, you stick to whatever guidance is given to you, in the belief or hope that this is the best guidance on the ground for you. And as Zafar was saying earlier, what happens in 2, 3, 4 months' time or years later, you can always come back and reflect or analyze as to what might have been the best way of working with it or working through it. And currently, you follow what's been given to you as a guideline and just stick to it.
And in terms of the people's health and in terms of exercise, I know that Boris Johnson was very keen to have that one walk where people actually go out to walk. And UK as a whole is not a very healthy society with the kind of fast food and what we eat. So how's the health impacted? And then you have obviously mental health and all these major issues. But from a health perspective, how would that be?
Well, I tried, made an effort. It was very difficult, I must admit, as an individual, to try keep yourself motivated to exercise, to go out for a walk. It's very difficult, and because there's a social side to exercise. You meet your friends, you go to a gym, or you play a sport like cricket or basketball. And forget me for a sec, because let's say I was slightly older, working through my day doing some work. For my boys, for example, they both exercise, they both go to gyms, they play basketball. For them to be in a complete lockdown and try to exercise at home, we tried to do exercise at home, and I can understand it's very frustrating. But having said that, this is what we had to face and we had to follow. And it's very difficult, yes, but there was no other option but to follow it. So I think initially there was resistance, there was frustration. People might have been angry or worried or even anxious, as you were saying. There's certainly the mental health impact of it. And I think, but eventually people came to the realization that this is the way forward. You stick to the rules. It's a few weeks of your life, 3, 4 months, whatever it might be. And eventually, inshallah ta'ala, it will all settle down. And take examples from other countries where they were peaking before us or where it happened before us, and just follow their lead, really.
Cool. Before I bring Professor Masoom Saab, Dr. Zafar Saab, I just wanted to mention to you this aspect of why have the four nations taken a different strategy in dealing with COVID, and particularly the three nations have differed greatly and disagreed with how England have handled that. Is that just a general political differences and their unhappiness with conservatives, or is it there's something more genuine here that's actually happening?
Yes, thank you very much, because it's a great opportunity for me. First of all, that I'm very thankful to the doctors that I'm with them online. I'm learning a lot of things there. And Dr. Munir, we sent us some questions. First, if I ask this question to my body doctors, Dr. Zafar Iqbal Sahab, the first question is, when do you think the mosque will reopen? Yes. Is my question to Dr. Zafar Iqbal Sahab, please?
I think Dr. Saab's moved to the back. You can ask Dr. Amir Saab, perhaps.
Oh, all right. Is it Dr. Amir Sahab?
Okay, Dr. Zafar Saab's back now, I think.
Yeah. Could you please tell me when the mosque will be open, please?
I don't know really. It'd be so I'm not involved in policy making. It'd be difficult to say. I'm actually more concerned about a second wave coming, to be honest. I can just you talk to ordinary people probably more than I do, and I get the sense that people are somehow feeling that this virus maybe isn't as serious as they thought it was when initially people got scared, and maybe people are taking. I know some of my friends, families, acquaintances. They're actually mixing together. So we may well get a second wave. So in terms of the mosques opening, very much depends on whether we can actually see that R number staying low. If that stays low, then I can see greater freedom in terms of public gatherings, whether it's conferences or whether it's mosques. But there will have to be some kind of arrangements.
Yeah, I see a lot of calls now from my friends and families there. They said that our children that are missing Quranic classes, and so they're so much worried. Is it possible about the online classes? What do you say about Dr. Munir Hasan Rabbani sir, please? What do you say about the online classes?
Yeah, I think a lot of the stuff has been moved online, and I would like Dr. Amir in particular to talk about this. But the universities have found it very difficult to actually cope with all of this. So, where I am based in Heriot University, they're having an integrated way of moving for next year. So, most of the lectures will be online via Zoom or any other platforms, and students will come in small numbers to do lab work. But Dr. Amir Saab, how is the situation in your university?
Yeah, so you're absolutely right. As we said, these are such different circumstances. We've never seen these circumstances before, so we had to adapt fairly quickly. And obviously, the concern was we have students at universities and how to carry on their education, but also as a medical university, how do they go back into clinical placements? At what point can they go back into clinical placements? There are all sorts of health and safety issues. The content of the course is manageable because you can do a lot of things online. And what we have learned that many things can be done online. And thanks to technology like Zoom or Google Hangouts or Microsoft Teams, we've been able to do a lot of work online. And now, as you were saying earlier, that people have found that they were actually more productive working at home and doing online meetings as well. So the same with the education. What we did, we planned that yes, we'll do some exams which will be online, different type of exams, but they were conducted online. Same with the delivery of some of the knowledge content can be done online. But at some point, a decision will be made as to when they can come back to the universities, when they come back to the hospitals for training, for example, or GP practices. Now, that's a tricky one. So we are still working on it. But also there's an issue of accommodation and students traveling back to the UK from other countries. So it's not just one element of delivering it. It's also when they start to come back, filter back to the UK, quarantine, for example, might be an issue. 2 weeks quarantine has been declared by people coming back. So that might just be another variable to think about as to how students might want to come back to the UK, what time, quarantine, for example. We have plans in place. I'm sure other universities have their own plans, but the place I work at, we have some plans in place. We already have conducted some online exams. We are looking at online delivery of education, especially of the lectures and some core content. And we are planning as to how we can bring back our students safely into clinical practice once it's allowed.
And part of the university, one of the reasons why the universities are so successful is their broad outreach. So we have students from all over the world coming, and this has had a huge impact financially on universities. My university, they've lost probably in excess of £20 million due to the summer schools and the summer training, and it's a STEM university, so we have a big Chinese market that's coming in that usually comes in. That's had a great effect. So on that, Sheffield obviously is a much more prominent university, and I'm assuming they've got a good endowment behind them. But would you worry for some of the smaller universities that perhaps don't have that kind of budget?
Well, I couldn't comment because not having enough information to comment on. But I think like any other person out there, I would worry about the fact that things are not like they were, like I said, 4 or 5 months ago or 3 months ago even, and there will be a impact. Dr. Zafar was already talking about the economic impact of the crisis, but there's also impact. There's a social impact. There's an educational impact, and I'm sure there will be an impact on how we conduct ourselves at universities.
Good. Professor, back to you.
Yep. Yeah, I'm receiving a lot of questions from community, from fellows here. From Glasgow now, the friend sent a message. They say he's doing a work in some factory. He said, because we can't follow the social distance because we're working together and there's much noise in the factory, and we come close to them and we talk them what we can do. His name is Kalimullah from Glasgow. Just send a text, please.
Dr. Amir, would you like to come to that? How do people work in factories and they can't maintain social distancing?
Well, again, my employer, we were very clear where I work that we can't work at our places, and rules and regulations are put in place very quickly. That the university is closed, for example, people are working from home. And if people have to go back to work or in essential services, there should be a clear guideline as to how they're supposed to be working. So it's down to individual organizations and suppose individual companies to ensure that those guidelines are followed.
I've seen this disparity between the non-Muslim community and the Muslim community. I mean, if I've gone to Asda and Tesco, I've realized that there are huge posters of social distancing in place. There's repeated warnings and signs. But if I go to my local desi grocery shop, it feels like, we're back to old days, pre-COVID. I mean, why this disparity between kind of the BME community and the non-BME community?
Did Zafar get that question? I'm not
sure.
Dr.
Zafar, do you want to come on to that?
I mean, it's certainly my person. Can you hear me now? I've got
we can clearly.
I mean, certainly my personal experiences. When I go back to Halifax, I've argued with the local shopkeeper about why is there no kind of measures taken to regulate who goes in and who doesn't go out. And he says, well, people aren't taking it seriously. And I think that is sad, because when you look at the risk factors, certainly Asians, Pakistanis are a very high risk for a number of reasons. For some reason we don't understand, but there are other reasons. First of all, they're often unhealthy. They've got diabetes or they've got heart disease. But also poverty is a really important part to play. Often the poorest communities will get hit the hardest. And also our culture is about mixing, we go to the mosque, our funerals, we have a lot of people attending, and all those kind of things really put us at high risk. So I really worry about our own Asian communities and how they might cope if we get a second or third wave.
Indeed. And I must say, we keep talking about, we talked about the BAME communities, but I saw the news over the weekend that there were people at beaches as well. And there were people, across the breadth of UK, there were people attending beaches and in pretty big crowds. And it scares you as a human being, as a doctor, as a person who's following the guidelines, because it just raises the risk of the disease itself. And as Dr. Zafar was saying earlier, the virus is still out there. The risk is real. The second peak might happen or may happen. So we still have to follow the rules as given to us, to the best of our ability, and not take it non-seriously, because otherwise, the risk is so real. We've lost, as I said, colleagues and friends and many people across the UK and the world who died because of it. So it's a serious threat and has to be taken as a serious threat.
I mean, we have a local a place here not too far from Glasgow called Loch Lomond. It's quite famous. Where people come. And the locals were complaining because of the coronavirus, the public toilets have been closed. So people who were visiting Loch Lomond were basically defecating on the streets, and the local residents were actually complaining about this. So yeah, I mean, you're right. Especially the non-BME community, they did go ahead to the beaches on the weekend, and there was that coming out of, I think, the strongest part of the wave that we've seen. I mean, I'm still looking at the deaths. It's around 100, 200, 300 sometimes, much more different to 700, 800. So, Dr. Zafar Saab, moving forward, how do you envisage the community coming out from COVID-19 and the different phases that are actually put in place?
I mean, in some respects, it's a question of how do we come out of it. We're only going to come out of it when you see the virus totally disappears, which is unlikely to do. It's going to be around some, we can't eliminate it totally, or we get a vaccine. So it's a question of whether we can contain it and manage it in a way that it doesn't overwhelm our health service. Because one of the things the government was really, really scared of was that we get the situation in Italy, whereby the peak is so high that the hospitals are just totally full and they cannot cope. Unfortunately, due to the actions of the government, we didn't reach that situation. When the peak did happen, I'm working in the health sector. There was plenty of beds in the health service. There were plenty of ventilation beds. The Nightingale hospitals weren't being used, so there was plenty of capacity. But it can easily switch very, very quickly. And I think in the future, if we get a kind of second wave, we need to ensure that our hospital capacity doesn't get overwhelmed. Otherwise, then it's a question of who gets into hospital, and doctors will have to make that difficult choice of whether it's you or you because of X, Y, Z.
There's a call I've received just from Bartley, is a Masoom Chishti. He asked me a question about what the duty of the parents when any guests come at a home. What the duty of the parents will you say, please, Dr. Ahmed?
Yeah, again, I'll be governed by the rules, and I'm looking at the rules from this morning. The rules have changed, and that you can meet in outdoor areas, parks, or private gardens with one other household, as long as you maintain social distancing of 2 meters apart. So again, if somebody is coming, and I think if you read from the guidelines, there's also provision of meeting. People who are shielding can go out and meet one person as long as you meet 2 meters apart. Correct me, Dr. Zafar, if I'm wrong by any chance. But the thing is, the rules are there to be followed. So if there's a guest, if is it essential if you want to meet outside, please do so. But do follow what the guidelines have been given to you today by the British government, by the English government, and follow the ones given to you in Scotland, Wales, and Northern Ireland.
Most of families, whenever the guests come in our house, and we see our kids, our children, to collect the pots after fetching the meal. We say, so what do you say about? We kindly advise them. He asks a question. A lot of people, they don't know about. Sometimes we say our kids now collect the pots after. What do you say about, please?
Zafar, would you take that question?
Yeah, sorry, I didn't quite catch your last sentence.
I didn't too.
Collect the pots after finishing the meal at a home. When any guests come here, we say our kids to collect the pots.
Well, there shouldn't be any guests coming anyway. I mean, at the moment, the national rules are very clear. You do not allow anyone into your house other than in certain circumstances. So there shouldn't be any guest parties. There shouldn't be any kind of visitors coming. I mean, you need. I think most of the Muslims that I know of, celebrated Eid at home within their families. They didn't go out and meet other people. Currently, the rules are that you can meet people in gardens and up to 6 people. Again, maintaining social distancing. Dr. Amir was saying those rules have to be followed. So there shouldn't be that instance of staying inside and washing other people's pots when they've come in and eaten, to be honest. In terms of young people, the other thing to bear in mind is that I've just come home from a little walk, and it's a big piece of ground, and mainly non-Muslims, and there were at least 2-3 crowds of 20 people. So 20 times 3, about 60 people, not maintaining any kind of social distancing. And I think young people, if that's an example to go by, perhaps aren't treating this as seriously for whatever reason, but they are putting my parents at risk, they're putting older people at risk, and they're putting those people with illnesses at much higher risk because of their selfish attitudes.
Yeah, and I would just add
Doctor,
to that. I think the instructions from the Prime Minister this morning, when I was reading through the news, was very clear that the friends and family can start to meet their loved ones, for example, but maintaining social distancing. So the key really is social distancing, and if you have to meet, you meet in outdoor areas or in a garden, but you maintain that social distance. That's absolutely vital to maintain that social distance.
Dr. Zafar Saab, you mentioned about the phase 1. Can you just very briefly explain what the 4 phases are going to look like in terms of the ease of the lockdown? And number 2, perhaps to tie in with that, when do you envisage the mosques getting back to normal? Would it be after phase 4? Or, I mean, I know Friday prayers are perhaps out of question here because it's very difficult. So if you could just explain that to us.
Yeah, I can't really sort of take a guess at when the mosque might open. I mean, my guess is that it depends on the R value, and I don't know whether people understand the R value or not. But I don't know whether that's basically. I mean, for a particular type of germ, particular type of virus, how many other people will get it from you, and the natural number this kind of virus lives at is 3. But if you introduce social distancing, then the number can drop down. Now, if that number stays down with this relaxation of measures, at some point they're going to start introducing, as I said, more communal gatherings, but maintaining social distancing. For example, conferences or sporting events or mosques or funerals. But again, people will have to maintain. I've seen pictures in other countries where people are reading their namaz but keeping 2 meters apart. So they might introduce that type of thing. It's difficult to gauge when the phases are going to be, but I mean, the way out of this is a vaccine, to be honest, and the vaccine doesn't look as if it's going to be arriving very, very shortly. It's going to take at least a year, if not greater. And just think, there's 7 billion people on the planet, and producing 7 billion vaccines isn't going to be easy either. So I can't see an easy way out of this, to be honest. I know I'm not quite answering your question about the phases. It's very difficult to predict that.
Okay. And then it's interesting how now COVID has dramatically spread in South America. So we were seeing there's been a huge spike, particularly in Brazil. So perhaps, does it seem like, the COVID peaks in one country and then it kind of goes down, and then we see a huge peak that's actually raising in a different country?
Can I just come? I mean, for example, if you look at Pakistan, it's still got much lower numbers than expected. Yeah. And to be honest, we don't quite understand why. We were talking with the Pakistan government a couple of weeks ago, and actually no one really understands why in a country like Pakistan it hasn't spread much further than it has, for example, in Iran, where it peaked very, very early, just next door neighbor. So it is quite. We don't understand quite a lot about this illness either. And at the moment, you're right. And the interesting thing about South America is that it's the poorest communities because there's very wide inequalities in South America. Yeah. You get very, very wealthy and very, very poor. And it's devastating the poor communities, the shanty towns. It's running riot through those. So those people, the very poorest, are being hit very, very hard in Latin America.
Interesting. Professor Masoom, you want to?
Sure. Yeah, just have a request from Dr. Amir, Ramsap. Just only please, you revise in all the steps to lower the risk of getting sick. What are these measures? What are the things like washing the hands and using social distance, like these things? Please repeat this all, because my colleagues and my fellows, community members, they call us and send a text and they says kindly repeat these things. And now the slogans are nowadays, that's a new one is we should keep in mind is stay alert, control the virus, and save the lives. What do you say about it?
I think, as I said, it's a fair slogan, and we had the initial stay at home, protect lives, for example. But now it's about staying alert. And staying alert means that you look after yourself, you look after your community, you maintain that social distance. Because end of the day, you also have a social responsibility towards your community and your fellow members of the community. If you're feeling unwell, you have to take the steps. If you are affected by it, you socially isolate yourself. So washing hands is important, and I think what I've picked up that people have learned to wash their hands. I've seen that kids come in, they wash their hands, and previously we might be guilty of, I might be working in the garden, not wash my hands properly, and just come and eat or take a drink. But now I've noticed, even myself, I wash my hands more frequently. As doctors, we tend to wash our hands more often anyway, or use alcohol gel to clean our hands. But having alcohol gel at home or sanitizers at home, some people are washing it more than they should be, really. I must be honest. You don't have to wash it 25 times a day. You just have to be sensible about it. But washing hands is always a good practice anyway. Our deen teaches us to be clean. Cleanliness is next to godliness, and we say it's sabai nisfi iman. We do wudu or whatever we do. It's like cleaning ourselves every 5 times a day. So I think it's a really good thing to know that you have to wash your hands. You have to maintain a social distance. If somebody's coughing or something,
you advise our you advise our listeners these things using the gloves and face masks. Please, you advise them.
Yeah, well, that's something I will ask Dr. Zafar to talk about, because I've not seen people wearing masks, too many of them, or wearing gloves in public. So I don't wear gloves. I've not been told to. I've not seen the news anywhere to wear gloves in public. Same with masks. So I'll let Dr. Zafar come on to that one.
Yeah.
I mean, the mask issue is quite controversial, and different countries have taken a different approach. You can interpret the guidance differently. My personal opinion is I think masks are a good thing, and I think we should be wearing masks out when you went to the public arena, when you go to the supermarket, or when you go to a shop. I think we should be wearing, because I think if you've got it, if you have actually got it and you cough, you're much less likely to spread it to lots of other people than if you cough within a supermarket and you've got it, you're going to spread it to so many different people, So I think mask is a good thing. And if I agree with Dr. Amir about washing hands, if there's one message out of here today, because people can get very kind of relaxed about it, and but washing hands when you come back from the supermarket, when you come back from shopping, when you come back from maybe outside activity, please wash your hands. First thing you do is wash your hands with soap and water, and that's probably the most important message to come out of today.
Indeed, and that is 20 seconds, isn't it? 20 seconds to wash your hands and with warm water.
Some people.
The virus killed.
Please continue, sir.
It's okay, carry on. It's okay, carry on. No, just because it does kill. The soap does kill the virus.
There's some echo.
Assalamu alaikum, Dr. Musharraf Sahab.
Wa alaikum assalam wa rahmatullahi wa barakatuh. MashaAllah, what a wonderful galaxy of experts we have. Dr. Amir Birni, Professor Masoom, and my wonderful Zafar Jana. Dr. Zafar, how are you? Good to see you.
Very well, thank you. Good to see you.
And Maulana Hasan Rabbani. Yes, carry on, mashallah. I'm just here to listen to. I don't know to. Yes,
and I must say, Dr. Saab, because for me also, I'm coming in really as a member of the community to listen to Dr. Zafar Iqbal and to listen to our other panelists, because what I take from here, I will go and inform my community, inform my family, my community as to how to stay alert, how to avoid the risk of getting unwell. This is not my area of expertise, but as a common person of the public, it's very informative for me. So it's a great show to have, actually.
Alhamdulillah. Yes.
Dr. Musharraf Saab, so one of the questions that obviously the whole Muslim community is asking is that since the government's outlined the 4 phases that it initially wants to ease the lockdown is which phase would we see the mosques activities coming into being, and when do we see life in the mosques springing up again?
Well, I think first of all, it's important to acknowledge, I think, moral and spiritual guidance and places where people can worship is actually a very essential part of human society. And I'm sure what is being looked at is when will it be safe enough, I think, and what are the signs of that, and how well are we equipped to do that as well? I think, are we ready to receive the worshippers in masajid? I think those are serious questions that need to be asked. And I know there's a government task force which is looking into places of worship. One of my friends, Dr. Asim Yusuf, is a consultant psychiatrist in Birmingham. He's the Muslim representative on that. And so I think they're just looking at all the, and they've done a lot of consultation, what recommendations they will put into place, and we then will have to implement and make sure that we carry those out.
Fantastic. Dr. Zafar Saab, just a quick question to you is that the Muslim community almost loves, doesn't take facts on the face values, and we're often a community riddled with conspiracy theories. Sometimes I feel that if the Muslim scientists of the 8th century golden age really knew what the Muslims of us were like, they're probably rolling in their graves thinking, what has the Muslim community come to? So what's your kind of take on all these conspiracy theories that have actually come out?
I wouldn't like to blame Muslims too much. I think there's plenty of conspiracy theories among the non-Muslims as well. And I think quite a lot of that has got to do with the level of education that people have. And when the people, if you look at America, there's a big divide in terms of those who went to college and those who didn't go to college. I think that makes a big difference. Dr. Msharafi, before you came, we were talking about how this is really important for the Muslim communities, partly because a lot of them are Asian or African and they're much higher risk, partly because they're at they have underlying health illnesses, so that makes them a higher risk. Fortunately, they are generally younger population, so that actually helps a lot. But I think the kind of question about how seriously people take it kind of depends on whether on the kind of literacy levels. And I know we were talking with the Pakistan government a couple of weeks ago, and some of the technical advisors were saying, the very low levels of literacy are really having a bad impact. And, because people just don't understand the concepts of a population approach and the importance of social distancing. People just don't understand that. And that's linked to levels of low levels of literacy.
Well, coming back to that point about being suspicious, to be honest, I think West is actually far more suspicious. The polytheism and materialism and idolatry actually makes you a very suspicious person. Seriously, I think there is a problem. Muslims might have a problem of fatalism. That's different from being suspicious. To be honest, I've spoken to many non-Muslims, and they too seem to have a lot of suspicions about things, and they're far more entrenched and far difficult to tackle than the Muslim ones, seriously. So I wouldn't, in fact, because the Quran and our deen has a lot of openness and transparency about things. And so we're, I think, mentally, to be honest, far more open in things. But because of the lack of education, there is some suspicion, but I'll tell you, it's far less than actually in the wider community. It is. Coming back to the conspiracy theories is something else, which again is something I think it's a product of the West, and when it goes into the Muslim society, then people begin to follow it. But I think it starts, you can squarely put it into, I think, to the Western society's actors, who come up with a lot of these theories and then promote it. And then it's taken up by our charlatans, and spread. The other thing about, people not following the rules, I think that's absolutely true in Pakistan. But here, I think people are quite respectful. My own community, I think they're quite respectful. They might not go to that extent in details sometimes, okay? Particularly when it comes to family matters, But I think, on the whole, I think they've been very, very compliant with it, really. Unlike Pakistan, where it is completely different situation there. Yes.
Professor Masoom?
What I've noticed that social media has made a lot of impact on people, and because people were locked down, they were reading all sorts of things on WhatsApp, right from Pakistan all the way to the UK, and then they would ask you some questions which you had no answer to. And I kept saying to my friends and some of my family members, stop reading into social media, do something else, find a hobby and spend time with your family. Don't watch the same news 24/7. It's the same news on a roll. It'll keep coming up, whether it's a channel here or channel abroad, doesn't matter. The more you see it, the more anxious you might get, and you distract yourself by other things. So I take your point about conspiracy theories, and people keep reading them, they just start to believe in them. And it just creates more anxiety in the room, really.
Yes, I think people need to be doing far more serious sort of worship, dhikr, reading, studying, and perhaps talking to one another rather than the media, social media, or the media itself, to be honest. It's actually, I now watch the Prime Minister's briefing perhaps twice a week at most, and only that for a short while. And news, BBC I used to listen to regularly and watch regularly, but I try to miss a day as well, sometimes 2 days, completely. Don't want to. It's so absolutely, and you're right, and Pakistani channels are terrible, because they only have one news. And the way they do it is just complete madness, and the noise in it, and the sound, and the way and they have no sensitivity about what they're showing. It is actually quite a ridiculous one. And if anybody watches that 20 times a day, the same news it's just crazy, and it will drive you crazy. Yes. So I think people need to be very cautious about watching too much of Pakistani channels, certainly, and the British as well. They're just as bad now. Yes.
Dr. Zafar Saab, I want to ask you about NHS. The whole aspect of privatization under the Tory party. And now people, I think, have a huge sense of respect and understand the great importance of NHS and this, this care and access to healthcare service. Whereas in America, we realized that people who had health insurance, actually, they lost it when, they were unemployed. So they wanted to get back into work just so their health insurance can cover them in case they have coronavirus, which, is a very murky situation. So how would the attitude of the British people turn to be when it comes to NHS, actually?
I mean, one of the really sad things about this whole episode has been, it's really heartbreaking to see so many of our own South Asian and African doctors dying because of COVID. And I think that whole thing is, and also nurses as well, and care workers and dental nurses, generally, the impact on the NHS has been measured in terms of how many people have died, and it's actually disproportionately much higher numbers than expected. I think Amir might correct me about just over 40%, 44% maybe of the NHS staff are BME, and yet the death rates are in the 70 to 80%. And you see, there are so many people I know of personally, who've actually suffered really, really, really badly. So I think that's maybe changing people's opinions, because I think, for example, seeing Boris Johnson going to hospital and people appreciating the level of care, the quality and the skill of those doctors in intensive care. People really do appreciate, and this Thursday clapping every Thursday evening, it makes people realize how valuable the NHS is.
Indeed.
But on the flip side, the NHS is very, very expensive, and it's still cheap compared to other NHS, to other systems in the world. But how is the country going to afford it, and how will the country treat the NHS staff when we come out of this? Is a really important question.
Yeah, and I would just add to that. I think and the NHS is such a precious thing to hold on to. It's one of the best things I've seen living and working in the UK. Nothing like this, I think, exists elsewhere. Maybe in Canada, maybe some other countries have a similar model. But I just feel the level of care you get from the nurses, from the paramedics, from the doctors, it is just phenomenal. And you're right, when you think of the current circumstances, how hard the healthcare workers have worked on the front line, and how they've sacrificed their lives, and how hard they work in spite of many difficulties. I do not work on the front line, but I know of friends and colleagues who have, and how they looked after the patients. It is phenomenal, and they must be given the right tribute for it.
Dr. Zafar, why is it that healthcare professionals from the BME community, there was a larger death rate amongst them compared to the white community?
Yeah, it's about, like I said, it's about 70-odd% versus 40-odd% of people being in the NHS. So I think I think it has changed people's attitudes towards BME communities, and hopefully in a positive way. They'll be much more appreciative of the sacrifices those frontline staff have made.
Amir, you will know that Professor Nadeem Qureshi is actually doing some studies, isn't he? Are you part of that group?
No, I'm not, but it'd be nice to see very hopefully informative.
Are you aware of what he's doing?
No, I'm not. If you do know, please let me know.
Oh, I thought you might have been invited to that. Zafar, you're not. You know, Professor Nadeem Qureshi here in QMC. He actually, I thought, was doing some work into this disparity and the inequality.
The government has given the government has given that problem to Public Health England, who have set up a committee which is going to be looking at that, and so I think we're waiting for the outcomes of that report. So that's the official government body which is going to be looking at
this
it.
is more local.
Then there are other things.
Yes.
Oh, local one. Yeah.
So this is a more local one by Professor Nadeem Qureshi from the QMC. But I thought you might have been part of that.
No, not because as I said, I work in a different city and I work in academics, so maybe that's why. But there are many surveys. There are many surveys out there. I know many organizations are looking to find why, how it happened, and why has it happened that the BAME community, medics, healthcare professionals, nurses, paramedics, and care service people have been affected by it. And there are many theories out there. But till the right research comes out, we do not know. And then hopefully we'll have the research and the results one day. Then maybe you can prevent such a pandemic one in the first place. And also if it happens again, God forbid, we might be able to protect our healthcare staff better and the general public as well.
I think one of the things doctors...
It's okay.
Yeah, I think the doctors were more expecting, actually, if there was to be a pandemic, it would be perhaps more of a resistance to the antibiotics rather than a virus, to be honest. I think that was the more sort of expected sort of pandemic. Is that right in public health? I mean, you must be very scared of getting more and more.
That's even scarier, to be honest.
Yes.
I mean, for people who don't know, for the last 30 years, we haven't actually developed a new family of antibiotics, which is amazing, really. And all the time, year on year, you get new bacteria, or all the bacteria which are developing super resistance. They're becoming super bugs. It's like fighting a group of people with superpowers, and we're dealing with old 30-year-old weapons. And if we get some superbug which spreads as quickly as a coronavirus, we're done for as a
I think that was the real worry.
We could lose a large proportion of humanity to antibiotic resistance. And after climate change, it is one of the highest risks facing humanity.
Yes, there's another thing to worry about. Yeah.
The climate, indeed.
Yes, Dr. Amir, please, I have a question because one of my friends sent a text. He's in isolation. That's NHS. The advice is to stay at home. And when he finishes food and something or sometime, he said, I cover my face and wear gloves, and then I buy all these things, stuff, and then I come back home. But the next time, I was thinking that I'm cheating with NHS. So what do you say about this? Now, if you finish the food, and what do you do?
Well, not my area of expertise. I'm not an expert in that area, so I'll let Dr. Zafar answer that question.
Right.
Sorry, what's the question? So this person has been advised to stay at home and he's going out shopping. Is that right?
Yeah, that's a good thing. This is a good advice for me.
Really, that's kind of very much. If that is true, that is irresponsible, really. The incubation period can be up to 7 days, where you may have the virus and you don't know about it. You're totally asymptomatic. So if you've been told you're living with someone who's got a virus, you should stay at home for 14 days.
Right.
And if you've actually got symptoms, you should, until they clear up, you shouldn't go out. At least if your fever is still there, there is no you could still be spreading the virus.
Right.
So I didn't quite understand the question, but if it was that this person has been advised to stay at home and is going out, then that is not really responsible, really.
That's very good. We are really very thankful to all my respected doctors, Dr. Amir Barni, Dr. Zafar, Dr. Munir Hasan, Rabbani. You give me time. We all together here in online, and I request all my committee members and all of us that be cooperative with the governments, and let's work together to protect ourselves, our families, and all the communities. So thank you very much. Thank you. Please, any question, please?
I would just say that I'm very thankful to the Karimi Institute, Musharraf Saab, Qazi Saab, who organized this program, to both our interviews as well, and Zafar Saab, because I think these programs are extremely important. As I said, I came in as a common member of the public to listen to what has to be offered in this program. I've learned so much already, although I think I'm a doctor, but I do not know everything, especially from a public health perspective. So if I do not know everything, then maybe members of the public do not know everything. We have to follow the rules. We have to follow the advice given to us by governments, follow them to the best of our ability, maintain social distancing, wash your hands. These are very simple things to do. And inshallah ta'ala, with Allah's will, subhanahu wa ta'ala's will, it will finish. I'm sure it will. This calamity will be over and we shall be meeting our loved ones. And finally, I would always say that my thoughts and prayers are with the ones who have lost their loved ones. And may Allah subhanahu wa ta'ala bestow the highest honor possible on them in the afterlife. And may all our friends, colleagues, and members of the public get well soon. So may Allah look after them. Thank you.
Amen.
Thank you very much.
Jazakallah.
Thank you. Thanks a lot, sir.
Okay, Jazakallah. Thank you very much, everybody. And Zafar, it's really nice to see you, and I hope everything is well.
It's really fantastic, and it's such a professional program. I've never listened into it before, and you'll have to send me instructions on how do I log into the radio program. This is a radio program.